For those few of you that don't know, I'm Gail Claus. I'm the employee health nurse practitioner here at the hospital. I'm really glad you could come out tonight. Dr. Downey, Rob Downey, is going to talk to us about HeartMath, which is a specific type of biofeedback. And it's a pretty exciting concept, a way of kind of thinking about and getting tuned into our bodies that's really different than what we've grown up thinking about how our bodies work. So I'm going to turn it over to Rob.
Hi, everybody. Thanks for inviting me. Does anybody want a handout that doesn't have one?
Oh, yeah. I didn't get one either. Thank you.
That's an appropriate shirt, Gail. I just realized
I
that.
wore it.
Always trying to match.
I like to be color coordinated. I'm fashion coordinated.
So I think it may help the topic along to understand my perspective on the topic. HeartMath is something that I use myself, and I have patients that use it. And it's a wellness measure that's been put in place for 2013 at SVT Health and Wellness where I work, though it hasn't been launched yet, meaning we're just getting ready to get these HeartMath biofeedback devices out to everybody. And my take on HeartMath definitely is influenced by my background. So I'm a board-certified family practice MD, and had the training that you would think of that goes with that, and a fairly gritty experience, I would say, in that now a big focus of mine, a huge area of interest, pretty much the area that I'm devoting the rest of my career toward in terms of my passion, is for wellness and vitality as a clinical tool. But the early part of my career was residency in the intensive care unit, delivering babies in the emergency department in Minneapolis, and then 2 years in Kotzebue from 2000 to 2002. And that particular site is, everything under the sun, because you're either going to care for it right there or you're going to ship it out. And I do think that doing that type of work, where I saw the heart attacks and strokes and young people coming in covered in lacerations from their snow machine accident while they were intoxicated, and just all that stuff, it really made both the part of me that's a physician and just the part of me that's a human being really reflect on, okay, this type of medicine, the gritty medicine is an endpoint of things leading up to it. So what led up to the snow-go flipping? What led up to the heart attack? And as I got more and more interested in that, when I ended up back in Montana, I ended up working with a lady who had training in Ayurvedic medicine, the traditional medicine of India. And long story short, I got training in a science-based approach to natural medicine called functional medicine. So I won't go into that too much tonight, but it's important to know that I've got about 8 years of experience training from the Institute for Functional Medicine. I'm currently in the certification pathway. It's recognized by the American Medical Association as a science-based approach with natural adjuncts to conventional treatment. So the functional medicine doctor isn't going to quit using statins for high cholesterol in the setting of coronary artery disease or what have you, but functional medicine MDs tend to push their patients harder to be more creative and vitality-based about saying, hey, look, we've got this data to show that food can make a huge difference. Food is medicine for mood, blood pressure reduction, etc. If I give you these principles to embrace and have you come back in 1 to 2 weeks, would you be willing to try this? Functional medicine does include herbs, but again, herbs that have scientific validity. So curcumin for inflammatory bowel disease, which is a derivative of turmeric. It turns out there's a ton of data on that, and there's even safety data and data about how it interacts with pharmacologics. So anyhow, functional medicine docs use a bigger toolbox, and that's why I have the interest in HeartMath, because one of the principles of functional medicine is that people often need restorative practices like yoga or meditation or laughter or a new job or a new marriage. I mean, could be anything. But so many of us in the age we live in are sort of living in a sort of an umbrella of this low-grade fight or flight that's just kind of smoldering all the time. And so as we get into the presentation, I'll talk with you about what HeartMath is and how it affects that. But thought it would help a little to know kind of where I'm coming from. So let me take a peek around here. Would you be willing to be a volunteer? Okay. Can I have you come up here? All right, I'll just have you stand here so you can see us all, so you feel like we're not ganging up on you. And I'd like you, this won't hurt at all, I'd like you to just clip that sensor to your earlobe if you would. Probably. And let's put you over there so you can be nice and comfortable. So, this is going to show here as it picks up your name, if you're willing to.
Karen.
Karen. All right, Karen, who's been kind enough to be tortured on short notice. Karen's heart rate is on this graph up top, and so what's happening is the heart rate wanders. And so you're seeing this graph over time. Heart rate's down at 70, it's up at 80, it's in between. And one of the key principles that's going to come up tonight, and what's probably not intuitive for many of us, is that the heart rate wanders as part of normal physiology. So, so I think for most of us it would be intuitive that if you're at rest, your heart rate's at 70 and it's just sort of plowing along at 70. And if you're exercising, it's up at 120 and it's zipping along to meet your needs. But it turns out that part of normal physiology is for the heart rate to wander. And all of HeartMath is based on this premise that what's called heart rate variability, how far it wanders between the peaks and the troughs, but also the character of how it wanders. It turns out that that has huge consequences in terms of our understanding of fight or flight, what balances it, and also how to use heart rate variability to our advantage. So, Karen, what I'd like you to do next is I would just like you to switch to breathing slowly in and out. And so if you can, I'd like your in-breaths to be for about a count of 5. And then I'd like for your out-breaths to be about a count of 5, if it's not uncomfortable. And so all I'd like you to do while you're willing to be our helper is just try to take slow breaths, about a slow count of 5 in, and out. And then the next thing I'd like you to do, and I know I'm putting you on the spot, but just that slow breathing is terrific. And I would just like you to now imagine that those breaths are coming and going from your heart. So as you take a breath in on a count of 5, breath out on a count of 5, I just want you to envision that the breathing is coming and going from right here. the final piece is I'd just like you to think about something you care about or appreciate, something you've got a really straightforward relationship with. So whether it's fresh air, your dog, your bike, your kid, again, don't want it to be something you've got a lot of mixture of emotion with, but just something you feel very, very pure about, that you care about or appreciate. As you take those slow breaths in and out from the heart area, all I'd like you to do is just have that sense of caring and appreciation as you breathe slowly. All righty. Thank you very much. And you're extremely kind to help, so we'll walk everybody through what you showed us. So, I'm not savvy enough with the software to back it up to the first minute, but the range increased when Karen started to breathe more slowly. There was a bigger gap between the peaks and the troughs. And it's a little hard to pick up here, but the pattern took on a little bit more of a sine wave. And if we hadn't just plucked Karen out and said, hey, would you jump in front of the audience and do this, it would have been easier to get into a smooth sine wave, or somebody who had done a whole bunch of this biofeedback over time. So this is really lovely. The degree to how smooth that sine wave is between the peaks and the troughs is actually reflected by these bars, and you can see at the end of Karen's session she was primarily in the high and medium coherence zones. And you can do that with just about anyone. Hook them up, have them go to the first step, which is it's called heart breathing, just visioning breathing coming and going from the heart, and then adding that sense of caring and appreciation. And almost all of them will go into more and more coherence right there on the spot. The reason I start with that demonstration is that heart rate variability matters over the long haul. It has ability to improve things that matter to you over the course of a lifetime, like high blood pressure, etc. But it's playing out second to second, minute to minute. So, diving in, we've done our little demonstration. What is HeartMath? It's a mindfulness technique. It includes biofeedback, meaning you can use your computer or this little device that attaches to the computer, which is called the M-Wave 2. This is portable, and you can actually have it out and about with you. It's got a sensor that'll pick up your heart rate and determine the variability, and it's got an ear clip, which we just used, and this will function independent of a computer. And so part of HeartMath is biofeedback, but the other part is some techniques. I have them in your handout, and at the end of the session tonight, we'll go ahead and go through some of those techniques for anybody that would like to participate. And the HeartMath techniques can be used with or without the biofeedback. That's really, really, really an important part of it. So why does heart rate variability matter? Heart rate variability correlates both with vitality and with the absence of vitality, dis-ease. So folks that are have higher levels of vitality, athletes, less of a burden of disease, have a wider range on average, and they tend to be more in that sort of sine wave pattern. Whereas folks that have been chronically stressed or have more problems tend to narrow that range down and tend to be in a more sort of chaotic pattern. It turns out that the way you think and the way you feel affect your heart rate variability. So of those two things, the surprise is that your emotion is 10 to 100 times more powerful at affecting heart rate variability than your thought. So if you say to yourself, you're on the monitor, it's all over the place, you're stressed, you're about to take a test, you just got a letter from the IRS, and you think, I gotta calm down, I gotta calm down. So that thought is be peaceful, be peaceful. It turns out it's 10 to 100 times more powerful to simply go ahead and generate a positive emotion to reset your heart rate variability. And so that's one of the operating principles that HeartMath works off of. I'm going to switch gears a little bit and talk about stress. The emotions that go with stress, and all of us know these, but they're still worth mentioning again. Anxiety, irritation, frustration, lack of control, hopelessness. Stress is really defined as those emotions. And one key issue is that stress is different from stressors. And so stressors are the circumstances that lead us to feel that way. And again, some of them are obvious and some aren't so obvious. So a patient who's getting sicker, or 5 admissions at once, or a sick kid at home on the same day, there's work responsibilities. Those are obvious stressors. More subtle stressors have to do with those of us who have associations with things that we perceive as threats over the course of our lives that trigger those feelings. And what HeartMath argues is that the stressors are hard to change. They're outside of you. But the emotions are within what's called your locus of control. HeartMath encourages you to replace one set of emotions with another over and over again over time, so that you keep rebooting that heart rate variability, and it'll keep coming up again and again over the course of the evening. The so-called negative emotions probably shouldn't be called the negative emotions because they have their place. If you were a cave person and a saber-toothed tiger came in and tried to take your kids and significant other away from the campfire, you should get angry and try to make the saber-toothed tiger go away. But the age we live in takes these emotions that probably have very limited utility in certain settings, and many of us have these emotions day in and day out due to the fact that there are stressors present constantly that weren't present in the past, or we perceive ourselves as stressed all the time, sometimes to the point that those feedback loops are running whether or not there's any actual stressors around at all. So negative emotion, what I've tried to do, by the way, is put the science of HeartMath into tonight's presentation without it being overly burdened with that. But a lot of science has come out of the HeartMath Institute over the last 20 years. By the way, I'm not affiliated with HeartMath. If you ever buy a HeartMath device, you're not supporting me. I'm not here trying to get you to do HeartMath or not. And there are other heart rate variability biofeedback systems. It's just that the HeartMath Institute really has done a huge, huge share of the research around this. They've got a sort of brilliant physiologist named Colin McCready, who has spent 20 years of his life not only understanding some of the parts we're talking about tonight, but the hard science, the nerves that run from the heart to the brain, etc. So as I make references to some of these things, it may sound to you like, hey, that wasn't in the textbook when I was in nursing school. And some of this is a little bit newer information that came out of the sort of early 90s onward until now. And again, it may not have hit the journals in a way that would have grabbed your attention. So negative emotions tend to disrupt physiology, and they also affect mental function in terms of diminishing crispness of cognition, ability to perceive a broad range of options versus a narrow range. Positive emotions, on the other hand, tend to facilitate physiology, renew energy, and optimize regeneration. This is the nervous system pathway that's involved in that. And so again, some of this is sort of new neuroanatomy compared to what many of us learned. You also want to remember that in nursing school and medical school, you typically were given what had already been vetted over the 10 to 20 years prior. So even if you feel like, hey, I was trained during that time, why didn't I get that? It may have been that it didn't make it into the, hadn't been considered cutting edge necessarily by the person running your curriculum. So here's this black arrow coming in. This is sensory input. And The default or slow track is that it's meant to come into the thalamus, run up through the cortex, which is your higher brain, kind of get sorted out, then head on down through the amygdala and other structures and on out to the body for whatever needs to be done with that information. Oh, it's my spouse, that's good. I'm happy and peaceful and I'm going to sit down. Oh, it's that dog that bit me last week. I'm going to make sure the gate is closed and get back from the gate. But again, default pathway is all sort of processed along this kind of slow circuit, and it involves the higher thinking centers. It turns out that your amygdala, which is this sort of cave person part of your brain, and it's hugely involved in emotion. Your amygdala is sampling this path. And the example that I'll give is you got bit by a dog as a kid, and then you live next to somebody that's got a non-threatening dog that's contained over there. But every time that sensory input comes in about the dog, the amygdala samples that information, and it says, whoop, dog alert. Superimposed on this is the fact that your right brain doesn't have any concept of time. So the place that the dog stress incident is stored, as far as your right brain is concerned, it just happened. So every time your amygdala sees that dog, it says, oh, I'm going to fire up the old fight or flight system. I'm just going to put a little surge down there just in case we need to do something. So if you're living next to this dog, every time you're exposed to the dog, there's the potential for your childhood circuit to get reactivated. And this one is called the fast track. And it turns out this fast tracking, that we gave a simple example, but let's say over time your brain becomes habituated to the idea that work is stressful, it's a threat to you, or your marriage is stressful, or where you live is stressful. You can have this fast track running all the time because all this information coming in. I'm at work, I'm living somewhere that's difficult or challenging. You can then have the amygdala just decide, I'm just going to shuttle that information down in case something needs to be done right away. And so this physiology turns out to be something that we can actually take advantage of and use for a reset because of some nerves that come up from the heart. And these same scientists doing the work, not just Colin McCready at HeartMath Institute, but a whole bunch of neurophysiologists and neurocardiologists, et cetera, over the same 20-year time period, they found something that's not intuitive at all. It's intuitive to all of us that your brain's got to tell your heart what to do. But what McCready and other researchers found is there's a huge set of neuronal tracks that go from your heart to your brain. So they're what are called afferents, meaning afferent means to. So they're afferents out of the heart to the brain. And furthermore, they found that when the heart is in that nice smooth sine wave, it shuts down that fast tracking circuit and it reboots your slow track. So HeartMath is based on the idea that if you can get back into what's called coherence, this smooth wandering of the heart rate, you can get out of a bunch of these broken record or stuck loops that the head and related physiology can get into.
Dr. Downey?
Yeah.
Would that also have implications for post-traumatic stress disorder?
Yeah. It's got
break the cycle.
yeah, and we'll talk about veterans in a minute. They're using it actually for folks out of Iraq and Afghanistan. So, depression, PTSD, anxiety, hypertension, diabetes. It's really amazing how much is showing up to have utility. But that part does start to feel pretty intuitive. We'll get into all these cascades that are triggered and what the HeartMath can help settle down. And you'll see on the first page of your handout, just from the HeartMath Institute, it talks about the fact that Journal of American Medical Association relatively recently had a citation that up to 60% of contemporary disease has a contributor to some degree from stress. And then just a little delineation looking down the body, the different types of things that can be related to stress. So coming back to that idea that emotion is more powerful than thought, let's talk about what gets activated then by these negative emotions. First of all, you have what's called the sympathetic cascade, and that is that's happening on multiple levels. And so at the level of your adrenal gland, adrenaline is released, which many of us know of as epinephrine, and that's out and about, wandering in the blood, doing its thing for a period of minutes or an hour or two. At the same time that those negative emotions are present, norepinephrine and neuropeptide Y are actually being released from the nerve endings about the body to increase heart rate, increase blood pressure, etc. And that's instantaneous. And then at the level of the hypothalamus talking to the pituitary gland, talking to the adrenal gland, cortisol is released. Cortisol wanders around for many, many hours. And again, with the premise being that many of us have this sort of triggering going on a lot of the time. And not all of us. I mean, I know some people that I don't think live in this state, but unfortunately I suffer from a bunch of the stuff that HeartMath is supposed to fix. So I really am glad that I'm doing HeartMath because it's making things better. So I would say more folks than not tend to have these chronic activation pathways that we're describing tonight. So the tendency of the neurotransmitter release, the cortisol release, etc., to happen due to these negative emotional states, all of that actually correlates with heart rate variability. So if you look at those folks that have that happening over and over again, and you measure their heart rate variability, there's really good scientific data to show that the two run hand in hand. And that's where that idea starts to emerge. Oh, well, if we could affect heart rate variability, could we flip it? Could we put ourselves into a position of having coherent heart rate variability and start to reverse some of these tendencies to feel stressed, be stressed, etc.? Let's take a peek and make sure I didn't miss anything important. I do want to I'll try not to read too much tonight, but I want to read to you a little bit because some of the language in here is really elegant, and I think for those of us that might feel like, gosh, that sounds interesting, but it just doesn't sound like there's the data to support it. I think it's really important to know there's some terrific data.
Hey, Dr. Downey.
Yeah.
Could you clarify for me just the notion of coherent?
Yeah. So coherence has two levels. Coherence is a reference to being in that kind of sinusoidal wandering. So in just isolation with reference to the heart rhythm, that's one level of coherence. And then what the HeartMath Institute argues is that coherence also has to do with getting the heart talking to the brain, and getting the heart and the brain talking to all the other systems of the body. And so coherence in its broadest sense is getting everything in sync and in that more sort of peaceful state. So according to an article in the Journal of the American Medical Association 2007, there is a documented link between stress and an increased risk for heart attacks, depression, cancer, and the progression of HIV and AIDS. Notably, an accompanying article in the same issue shows that workplace stress may be as bad for one's heart as smoking and high cholesterol. And I think we've adequately discussed the fact that this idea that there's these nerves that come up from the heart. One other piece of neurophysiology that's really interesting and important is that the nerves that affect your physiology, you have 10 to 100-fold more of those nerves coming from the emotional centers of the brain than you do from the thinking centers. So again, if you want to look for a point of leverage, it's the ability to change your emotion that has much more of an effect on heart rate variability than the ability to change how you think. And the reason I'm going to hammer on that is because that's where your friend over a cup of coffee is going to say, well, that's a bunch of crap. If you feel good, that's not going to help. And the HeartMath folks are going to say, the science shows if you feel well, that helps more and faster than positive thinking. Again, positive thinking is terrific, but if you want to get the most bang for your buck, you want to get into a positive emotional state over and over again.
And at the same time, that's not suppressing. That's,
No,
that's
what?
engaging. I mean, it's
Yeah.
trying to figure out, because there are people who, hold it down
Right.
in reserve, thinking that they're really dealing with it.
Right.
But that may not be the best.
Well, there's a lot that's lovely about HeartMath once you've sort of seen what other approaches do or don't do. And I would compare HeartMath to escapism. So I would say, we live in an era where people are messing around with their digital devices or going to the bar or watching movies or doing whatever they do, to kind of get away from the world. And one of the premises of HeartMath is that the world is there. Embrace it. It is. My friend John would have called it radical acceptance of what is.
Yeah.
And so go ahead and say, it's there, it's doing its thing. And then have these positive emotions superimposed into, on top of however you want to visualize it, with what is happening. So, you'll see in the techniques that we do right at the end how HeartMath has structured that. But one of the key principles is that HeartMath isn't an escape into a positive emotion. It's simply the addition of a positive emotion to whatever is going on. So, another thing that comes up is that you don't have to be in these chronically stressed states for more than a few days to start to. A logical question would be, well, what are you talking about here? I mean, are you talking about my fishing trip going bad, or are you talking about 10 years in the wrong job? I mean, how much of the stress actually starts chewing me up? Well, it turns out once you're 3 or 4 days into being stressed, your ratio of DHEA, which comes from the adrenal gland, to cortisol, which also comes from the adrenal gland, starts to shift. The reason is the precursors to DHEA and cortisol are the same hormones. And if your body has to make more cortisol due to the stress, it's going to skimp on making DHEA. And so the states that have been associated with abnormal DHEA to cortisol ratios include accelerated aging, brain cell death, impaired memory and learning, decreased bone density, increased osteoporosis, reduced muscle mass, reduced skin growth and regeneration, impaired immune function, increased blood sugar, increased fat accumulation around the waist and hips. So I don't want you to feel like, oh man, I got stressed for a few days, now everything's going down the drain. But I mean, it's just that if these things add up for a few days, that's not so good. If they add up for weeks, you've got a deeper groove in that broken record. If they go on for months or years, it's harder and harder to get out of that rut. And the related thing is happening that all of us did get in our neuroanatomy is what fires together wires together. So all these nerves that are involved, if they're used to the default being stress and these various physiologic states, at some point those nerves start to say, well, that's just kind of the way it is. That's normal. That's my comfort zone. And we'll run into it a little later. One of the troubles that comes up with HeartMath is sometimes when people are using these techniques, they'll start to feel and do better, but then they get stressed because it's new. So one of the things you have to coach folks doing HeartMath is say, hey, hang in there. If it feels different and kind of good, but weird and a little stressful to be changing, that's a good sign. So we just chatted about the idea of what's familiar is secure, even if it's depression, anger, anxiety. The new can have an unease to it. Enough said. The thing about coherence that also will be probably really interesting to folks who know about the autonomic nervous system is that the fight or flight system is balanced by what's called the parasympathetic nervous system. And these two companions are the primary determinants of heart rate variability. And just so everybody's on the same page, your autonomic nervous system is this really, really old part of your brain and spinal cord and nerves that run around the body. And it's unconscious. So it's doing its thing when you see that dog. It's not coming from your cortex so much. And it's the part of you when you see a bear that gets you out of there. So the autonomic nervous system has two halves, and they balance one another, and they talk to one another. And the sympathetic side of the autonomic nervous system is fight or flight. And then the parasympathetic side is the brake. And the really fascinating, elegant part of that design is that the brake is on all the time. The vagus nerve is sitting there all the time, dampening that fight or flight side that's saying, hey, what's going on? What are we going to do next? So the vagus is just sitting there as this dampener. And one of the effects that's instantaneous when you get that stress trigger, vagus nerve shuts off instantly. And then it comes back on and says, hey, we better have the brakes. And then you're stressed again. It goes off. So these sort of chaotic heart rate variability states, these have been shown by the folks that study these things to show that the sympathetic or fight or flight system is too ramped up and the brakes are getting taken off repeatedly or for long stretches. Another interesting thing about heart signaling, in addition to the nerves we talked about going up to the brain, the heart actually was categorically included in the hormonal system when it was found that natriuretic peptide is released. This was initially called atrial natriuretic factor, and we measured in the hospital as natriuretic peptide for patients that are in congestive heart failure. And so there's hormonal signaling going on that comes out from the heart, and then it turns out that the heart releases oxytocin, which is the love and bonding hormone. And the heart has as much oxytocin in terms of tissue concentrations as the brain. And then finally, there's no other organ in the body that's got more nerves that go from the organ to the brain than the heart. So just kind of looking at patterns in terms of heart rate variability, every year that goes by you lose a little. And so somebody who's 70 has less of a range of variability than somebody who's 20. The sports medicine folks have looked at the fact that if you improve heart rate variability, you improve performance. Just as a reminder that this can be either a measure of disease or vitality. And this would just be overall the amount of time that the person is in what's called coherence, which is this more sort of sine wave state. Talked about improving health and vitality, resilience versus reducing disease burden. And HeartMath has utility in both of those settings. So I just want to jump ahead here a little to what some of the data has shown in terms of what HeartMath can help. There's data showing benefits in reducing depression, anxiety, anger, hostility, burnout, fatigue. It's been shown to increase caring, contentment, gratitude, peacefulness, vitality. In terms of risk factors for disease, HeartMath is shown to be helpful for reducing blood pressure. Systolic reductions of 10 points are average, and diastolic reductions of 5 points are average. Glucose levels tend to be lower. Cholesterol levels tend to be lower. In patients with congestive heart failure, there was less depression, better regulation of blood glucose, better quality of life, and even asthma has shown to improve with HeartMath. The military is using HeartMath for post-traumatic stress disorder, and I thought that all of you that care about veterans, and I certainly do, if there are any veterans in the room, I always try to remember to thank you for your service. I thought you might like hearing this anecdote. All the branches of the military use HeartMath now, and it's being used by NASA, it's used at Duke, it's used at Stanford, it's used at Mayo Clinic. I mean, it's really becoming prevalent in many, many, many big organizations. And it can be used as a wellness tool just to keep people well in the workplace, or it can be used as a treatment modality for people that have certain target problems. So this is a man who, he says, I am an OIF and Gulf War veteran. I recently returned from Iraq where I experienced 5 IEDs and 1 RPG explosion. To deal with all the pain I felt after I got back, I self-medicated for several months with alcohol and marijuana. But after weaning off of both, I was determined not to use narcotics of any kind to cope with the pain. Being part of this experimental heart rate variability training program has changed my life and given me a practical, non-medicated way to reduce the pain and handle the stress. One time in particular, stress from the relationship with my wife was robbing me of sleep and causing me to lose control. I remembered the M-Wave tool, and after about 30 minutes of practice, I was calm and able to go back to sleep. The benefits of HRV training are so much better than medication because I am learning a way to self-regulate anywhere, anytime, without risk of dependency or that drugged feeling. I'm so grateful for being part of this pilot study. My last blood pressure reading was 115/76, compared to previously when it was 120/95. My heart rate has dropped from the 90s to the 70s. And there's another study that just showed, this was a very small cohort, 5 individuals who participated versus 5 controls. But they just showed that people that had, with post-traumatic stress disorder diagnosis out of the military, who had improved heart rate variability, had less of that cognitive haze that goes with PTSD. Nicely designed study on that. I think in the interest of time, I'll just mention that similar benefits have been noted for about 70 correctional officers that were studied. A couple of neat points that came out of the study that looked at those folks, though, was that they also checked their cortisol levels and noted that those improved. They saw that these individuals had better productivity and motivation, goal clarity, perceived support, and they did a calculation. The mean difference between pre and post intervention projected healthcare cost was calculated to be $1,179 per employee per year. And again, we're talking about, a $200 device and 4 hours of training to get somebody certified to teach it. So it kind of saddens me to see, what's happening nationally, where we're trying to figure out how to pay for all these MRIs and heart catheterizations. And I mean, the measures are there. If we got serious about vitality as an intervention, we could make huge inroads on some of this stuff. This is as good a time as any to remember to mention that big places like Kaiser Permanente and other big hospitals that put HeartMath in place as a wellness measure saw their turnover rates drop on average. The citations were 20% down to 3%, 15% to 0. And so they just were able to, the savings that were reported by these 3 hospitals were $800,000, $1.6 million, $2.6 million. It was just shockingly effective at shifting some things around. Congestive heart failure is kind of interesting because so many of us think of it as like, wow, this is pump failure. There's some serious plumbing problems there. How could it help for the person to feel positive? Well, it turns out that normalizing heart rate variability just does so much to optimize and improve the system. These elderly patients with congestive heart failure had a statistically significant study showing that their perceived stress, their emotional stress, their 6-minute walk, and depression all improved. So you kind of get the picture. I wanted you to know that people do studies on HeartMath that aren't proponents of HeartMath, so this isn't necessarily like asking yourself, okay, Pfizer funded the study on the drug, so what does it tell me about the drug if Pfizer funded the study? So Mayo Clinic, they actually had their oncology staff use HeartMath over a period of 3 to 6 months, and these oncologists and nurses treating cancer patients had just their stress scores were significantly improved across the board. So kind of a lovely anecdote there. And then this is the This is just the HeartMath summary, some of the outcomes data. But again, I think that was a pretty good summary, talking about the retention and what have you. So thank you for bearing with me through that. We're going to switch gears and we're actually going to do some of these techniques. So you need to position yourself comfortably in your chair. Actually, let's stretch. Let's get the kinks out. But you don't get to leave. Alrighty. And now what you need to do is, I'd like you to go ahead and be seated comfortably in your chair. And I'd like you to take that hand out and find the technique that is described as quick coherence. And just to let you know then, you can, in a moment, I'll be having those of you that feel comfortable doing it, closing your eyes. But when we're done with tonight's session, anytime you want to, you can refer back to quick coherence and do these techniques. And again, all the techniques that are in your handout, you don't need one of these devices to do. So you can just do this anytime you want to. So I'll be actually reading you through the script from HeartMath for quick coherence. And so if you feel safe and comfortable doing so, I'd like you to get as comfortable as you can and close your eyes. If you feel better with your eyes open, that's fine. The power of the quick coherence technique comes from positive self-activating emotions. You will learn how to engage positive feelings anytime, in the moment, when you're feeling a stressful or draining emotion. The technique is easy, but each step is important. All the steps together take less than a minute and work like this. Focus your attention on the area around your heart. Breathe deeply, but normally, and feel as if your breath is coming in and going out through your heart area. Activate positive feelings such as appreciation or care. Perhaps recall a fun time when you felt good inside. Try to re-experience it. Once you become familiar with these 3 steps, use the quick steps: heart focus, heart breathing, heart feeling. Heart focus shifts your attention away from the mind so you can tune more into your heart. Heart breathing shifts your system into increasing coherence because the rhythm of your breath modulates the rhythm of your heart. This is why it's calming to breathe slowly and deeply when you're stressed. New breathing rhythm changes the heart's rhythm, which in turn has a powerful soothing effect on the brain and the entire body. Breathing at the count of 5 to 6 in and out helps bring order to your nervous system. Heart feeling helps you sustain the coherence begun with heart breathing without having to remain focused on your breath. Many people find that when they experience positive feelings like care or appreciation while breathing through the heart area, they immediately feel uplifted and regenerated. The reason we call these heart feelings is because they change how your heart is beating, and people often refer to such feelings as coming from the heart. Sometimes, if you're accustomed to feeling more negative than positive, this may feel unfamiliar at first. For now, simply make a sincere effort to feel and hold the positive emotions by recalling a positive or fun time in your life and re-experiencing it. If it's hard for you to recall anything positive now, let's take some time to remember and write down those times when you felt uplifting feelings. It's helpful to memorize them so they are easy to recall when you practice the quick coherence technique. Remember, even a sincere attempt at feeling a positive emotion will start reducing the drain and replenishing your system. Practicing makes it easier to sustain coherence for longer periods of time. It will become more natural and familiar to your system, making it much easier to remain calm and balanced in challenging or stressful times. And whenever you're ready, open your eyes. we'll do one more HeartMath technique at the end of tonight's session, but I wanted to walk you through the science and physiology of HeartMath before sort of talking about what people do day in and day out. So people who use HeartMath use quick coherence, even simpler tool, which is just called the neutral tool, which is just slowing down your breathing and paying attention to your heart. They'll use a tool called attitude breathing, and we'll talk about that in a minute. And about 3 other techniques, so there's a total of about 6. And the idea is just to do those things over and over again during the day. So I'll go ahead and give an example. We've been stressed for 6 months trying to sell our house in Montana. We can't buy a house in Alaska. I've got kids. I've got a 75-year-old mother-in-law. So every time I think about this damn house that won't sell, I go into stress mode. And I think I have the same tendency that many individuals do, which is to think this stuff is so simple it couldn't possibly work. And also, because I'm male, and I'm going to pick on men for a second, I really had to be suffering before I took the time to implement the fix. But what I noticed with all of the stressors, this one just being one example, since I've started doing HeartMath, which has been for about 6 months now, that quick coherence technique is really, really powerful. And I find that now I'm not even thinking about it to activate it. I'll just notice that there's that kind of metallic taste in my mouth, that kind of feeling like, whoa, there's the stress. And so I do exactly that little protocol. I just slow my breathing down. And again, I actually take the time to slow it down, because it's one thing to think about it, but it's another to do it. Is it 5 to 6 counts out? Is it 5 to 6 counts in? And then I go ahead and focus on the area around my heart and envision the breathing coming and going from my heart. And then, if you have a mixed relationship with your kid, or they're an adult and they move to San Francisco and you don't want them to, maybe you shouldn't envision your kid. My kids are at delightful ages, and they're the most effective way for me to get into a sense of caring and appreciation as I just think about my kids. The other thing that I found really, really effective is really, really simple stuff. I'm appreciative of clean air. I'm appreciative of the beauty of this place. In the era we live in, I'm appreciative to have a job and a roof over my head, health and vitality of people I love. So just simple things, but just that sense of caring and appreciation. And to take this back to what Shara mentioned, it doesn't matter that the house hasn't sold, and that's right there in my face, and it's bugging me, and there are real consequences, and it really is stressful. Because with that quick coherence technique, your heart reboots your head, and you can feel it as you get used to doing it over and over and over again. And the most lovely flip of all, and again, I'll just speak for myself, I got more gray hair than most 45-year-olds. So, I had a tough relationship as a 20-year-old. I went through pre-med, med school, residency, Alaska, kids. I've been chronically stressed. It's not fancy science. I don't want to keep aging at the rate that I aged between 20 and 45 if I want to have any fun when I'm 70 or be a productive member of society. So the idea that this really, really simple technique done over and over and over again can be incredibly powerful, it's really borne out in the data. It's borne out in folks who are doing this, and it doesn't even require one of the devices. It just requires the shift into that idea that rebooting over and over and over again matters. So anyhow, quick coherence is the most commonly used technique. There's the neutral tool. They're all in your handout. The other thing that HeartMath Institute talks about, in addition to the techniques, is just what's called building coherence, and that's where the devices come in. The data shows that people who actually know what their heart rate variability is doing, so on the computer screen for 20 minutes, or just putting your finger on one of these little portable devices for 5 minutes, you're simply giving your system more information to reset itself. And that's the whole rationale then behind having it on a computer program or on a little portable device. The HeartMath folks will say, with the portable device, It'll count how much you're in coherence, and once you've been doing it for 5 minutes or so, it'll sort of build up these rewards and give you a little gentle ding, which is called a reward cycle. So if you can do 2 reward cycles a day, that's good. If you can do 20 minutes a day on your computer, that's good. If you can do little sessions here or there, that's good. The irony, though, is for many of us who've been chronically stressed, as we start to improve with the HeartMath, it feels weird and it feels different. Or the little device isn't in coherence, and you're like, well, that's stressing me out. So one of the tricks to HeartMath, akin to what many people who've meditated have found, and again, this isn't meditation, it's a different system. This balances sympathetic and parasympathetic drive and gets the 2 systems talking to one another, whereas the data on meditation shows that it tends to build parasympathetic tone. But the principle is the same in that improvement has its own stressors that come with it. And so one of the tricks is to just keep being in coherence more and more and more often. And when the little device isn't in coherence, or it feels like, wow, this is weird and different, the right thing to do is just keep going. Keep that slow breathing going, the focus on the heart, things that you care about and appreciate. One other really important distinction, and I like and respect it about the HeartMath folks, that they haven't made what I would see as a mistake. They don't refer to happiness. They refer to caring and appreciation. And I think, I agree, the idea that happiness is elusive, I don't know who said that, but I think that it's true, and I think it's a rare state of sort of nothing's wrong, everything's good, everything's going my way. And HeartMath is much tougher than that. It's meant to be with you when everything is going on and going down, and put you into a peaceful state that isn't driving all of that fight or flight and the getting chewed up that runs with it. So it also cues you that, reflecting on happiness, and again, maybe it's a really effective tool for you to think about your last vacation, but I find when I'm using the devices, and I am now, I've got it on my computer and a portable device just because I've got access to them through my work. I find that the things that I care about and appreciate are even more powerful at resetting my variability than the things that, quote, made me happy. And I think that's kind of good news. So let's do one last technique, and then there's time for questions and answers if people are interested. So this last technique is called attitude breathing, and this is a variation on a theme. And so the goal of this exercise is to pick an emotion that is particularly troubling for you. So for me, it would be anger. Came by it honestly from my dad. And it's going to be different for different people. It may be anxiety, it may be hopelessness, it may be irritation. But again, if you're not burdened by any of those things, terrific. I'm delighted for you, and I hope it stays that way for the rest of your life. Anyhow, for anybody that does ever have trouble with these negative emotions, you want to pick one that's a real bugaboo for you. And then I'm just going to, again, read you through the script. The idea, though, is that you would pick a substitute for this. So to get you ready for the exercise, here's what HeartMath recommends. If the unwanted feeling is stress, replace it with neutral. Unwanted feeling of anxiety, replace it with calm. Replace overwhelmed with ease and peace. Replace bored with responsibility. Replace judgmental with tolerance. Replace fogged and confused with neutral. Replace angry and upset with neutral or cool down. Replace fatigue with energy. Replace shame and guilt with self-acceptance, forgiveness. Replace financial worries with abundance. Isolation and loneliness with being connected and appreciated. Rebelliousness with respect. And self-pity with dignity and maturity. So I'll ask you to get comfortable again. Close your eyes if you're comfortable doing so. The attitude breathing technique helps you replace draining negative attitudes with healthier positive attitudes. This is how it works. Recognize a feeling or attitude that you want to change. Identify a replacement attitude. And then breathe the feeling of the new attitude slowly and casually through your heart area. Do this for a while to anchor the new feeling. Often the replacement attitude can be obvious, but it takes breathing the feeling of the new attitude to make it real. For example, if you feel angry, you may want to replace it with calmness. This requires breathing the feeling a while until you actually feel calm. Then you've made the energetic shift. If you can't identify a replacement attitude, breathe the feeling of neutral to stop the energy drain. It especially takes breathing the feeling of the new attitude to make an energetic shift. If you're not clear on the new replacement attitude, remember that the neutral attitude works to stop the energy drain. This is particularly important during an emotional storm. Remember to breathe slowly and casually. Do this for a while to get the full benefits of the tool. And you can open your eyes whenever you're ready. Oh, 5 minutes over. That's not too bad.
He started 5 minutes late.
There we go. Do people have questions? Yeah.
I'm not quite sure the difference between meditation and this and this so much as, because I meditate quite a bit.
Right.
And I'm trying to understand the difference between the two. In the beginning, I was starting to understand a little bit more about why meditation works.
Mm-hmm.
But yeah, if you could explain that a little bit to me, what the difference would be.
Yeah, so it's definitely an oversimplification to say that meditation only focuses on parasympathetic tone and that HeartMath focuses on balancing sympathetic and parasympathetic, but it holds up pretty well. And so there has been a lot of physiologic study done on meditation, and basically what meditation tends to do, as far as the physiology we talked about tonight, is that it tends to make that vagal nerve and all of that parasympathetic braking very consistent and very powerful. So there's this terrifically powerful dampener present so that fight or flight signal and drive has a bigger firewall that it has to get through, actually ramp up the system and get that cortisol release and get all that disarray and heart rate variability. So it's a hugely powerful tool just to have a very, very robust parasympathetic restorative side of the autonomic nervous system that isn't rattled or diminished by the fight or flight side. I do want to mention the depth of benefit that goes with meditation is far beyond parasympathetic tone. And just because it's so fun and interesting, I have to cite one study. The guy that looked at this at Harvard, Herb Benson, in the 1970s, described this thing, which is the follow-up to the stress effect described by Hans Selye. And so what Herb Benson called it is the relaxation response, and he studied Tibetan monks. When he started doing this in the 1970s, well, I went and took a class for a week from this guy, so I got to hear all the war stories. Anyway, he's studying Tibetan monks, looking for this thing called the relaxation response. So they stuff him in this back lab in this old building. Nobody wants to be associated with him. They think he's a nut. But he finds over time all these fascinating things. Well, by the time I got to work with him, there's a building named after the guy, the Benson Henry Institute. And these initial studies were fairly rudimentary, but the study that he cited that I thought was staggering is they took Tibetan monks, so lifelong meditators, and they compared them to a control cohort of individuals who didn't have any training in meditation at all. Then what they did is they checked their genetic expression. So they were actually able to do studies and say which genes are flipped on and which genes are flipped off. And this is all possible because of the Human Genome Project, and in fact you can actually check this stuff. The cool thing, they then took the non-meditators and they had them do 45 minutes of meditation a day for 12 weeks. And then they looked to see how much their genetic expression shifted toward the group of meditators. And they had like 1,500 switches flip in their genetic expression in genes that are known to regulate things like resilience, positivity, immune function. So the non-intuitive part was that they were able to turn on a whole bunch of these genes that the monks had turned on with a life of meditation just by meditating 4 to 5 minutes a day for 12 weeks. And so anyway, anytime meditation comes up, I meditate myself. I mean, my current sort of idea is to meditate in the morning and do HeartMath at night, just in terms of finding the time and where the energy makes sense. But what the HeartMath folks will tell you is that experienced meditators find that 5 minutes of HeartMath before meditation is a really, really powerful adjunct. And the thing that the HeartMath folks come back to over and over again is that it really is different to boost your parasympathetic tone versus putting sympathetic and parasympathetic in sync. And then it comes up with performance issues because no one would argue that meditation is bad for work performance. I think that knows anything about meditation. But part of what's pretty cool about HeartMath is that it tends to be activating, because instead of just boosting sympathetic tone, it gets those two systems talking to one another and functioning in a very smooth fashion. So athletes and people that have high output jobs like law enforcement, hospital work, etc., have found that HeartMath feels good because they feel activated during and after doing HeartMath. And I would say the ideal thing would be to do both heart rate variability improvement and meditation for the individual that's really, really serious about restorative practices.
I get it.
Is that helpful?
I see, yes, very much so. I see the difference and how they can both be really helpful. Because meditation goes to a deeper place. You're wanting to accomplish something totally different than with the HeartMath, and I can see whether two together can just really be profound.
Yeah.
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 Yeah, I think that, the chink that the meditator may have in their armor is that if they are somebody who has lots and lots of long-term burdens of negative emotions, getting some of that dead wood cleared out could really enhance the power of the restorative power of the meditation. And then one other just editorial comment you might find interesting is that some of the meditative traditions do have a heart focus. So there's, in Tibetan Buddhism, there's the Heart Sutra, etc. So I think these things start to blend. And I think lots of people who are familiar with sociology or cultural issues would point out that, everything from the value of a sense of humor to being a good person or caring about the well-being of others is activating these positive feelings in the heart that put us in coherence. So some of this is just really, this is coming from really, really old reservoirs of human wisdom. It's just getting put out there in a new format that's sort of more understandable in the age we live in, or it's getting put out in a format that people can kind of grab until it becomes intuitive to them to be in those positive emotional states.
How do you imagine integrating this into your clinic with people?
Well, I think that people probably should do the 5 to 20 minute sessions once a day on their little M-Wave 2 portable device or the M-Wave on their computer. That probably should be done independently. I could see workplaces carving the time out to do it, but it'd be a lie to say that we feel like we're able to do that. And though we're going to try to have a dedicated computer in the break room so that if people do have time off at lunch or what have you, they can go hook up and use it. And again, everybody will have one of these devices, and they are certainly encouraged to take little timeouts here and there, I guess as appropriate. So like right in the middle of signing a patient in, maybe not so good.
Mhm.
But if there's a down minute, SVT really has made that commitment that that this is encouraged and deeply endorsed. And so if somebody's taking 2 minutes to see what their variability is doing, they're probably going to be doing that technique, one of these techniques concurrent with it to try to bump their variability up. And you know, we expect to catch one another being good, right? Say, oh, that's cool. You know, how's it going? So I think room for there to be little bits of it throughout the day, really from an efficiency perspective. We didn't talk about it too much during the talk, but this dampening, when those sort of chaotic variability states, irritation or any of those negative emotions can generate those. And so when that's happening, there's fight or flight thinking to a subtle degree. So it's like there's 2 or 3 options. I gotta get this person signed in right now, or I gotta tell them to go home, or I gotta tell them to call their insurance. But there's that kind of angry, pressured feeling to it that I think really has a fight or flight quality to it. So I think if people are in coherence, they're much more likely to say like, oh yeah, I remember that paperwork came in last week. I'll just pop over to the next office and grab it, and then, you know, just be comfortable for a minute. Can I get you some water or a cup of tea? I mean, that's stuff that all of us know is just incredibly powerful for people. It's just incredibly soothing, and it doesn't take any more time. It takes less time, because then they quit freaking out, you quit freaking out, and things just start happening the way they should. So anyway, I don't think we'll be able to give people the 20-minute sessions on the computer, but I think there will be genuine encouragement to be using their little ambulatory device. We haven't firmed up our launch yet, because my worry is if we do it in a half-baked fashion, people will get these devices in an age where lots of folks don't like new technology. Like, I already fight with my iPhone, and my computer kicks me in the teeth every time I turn it on. I can't find the TV remote. Now somebody wants me to use a new digital device to decrease my stress. So I think we're going to need an hour with half the staff times 2. Divide them into 2 blocks, give them the device, walk them through a presentation like this, and say, you know, okay, here's your device, here's how you turn it on, here's what it means. And then we're going to let them know also that I've taken the certification class from HeartMath, but our behavioral health person, Wendy Russ, and our Chinese medicine acupuncturist wellness coach, Amy Rattenbury, they actually watched all of the certification stuff with me. And they all know enough about biofeedback that any of the 3 of us are a resource. We're encouraging people to come to us and say, I don't think this is helping, what do I do? I try to do this. So we're trying to have 3 people in the workplace. And HeartMath actually has, we didn't take advantage of it. We put our bucks into the devices. Maybe there was a little hubris on my part, feeling like, okay, I'm a vitality-based physician for 8 years. I ought to be able to figure out how to help my workplace. But HeartMath can actually set up workplace programs. So you can contact them, and they'll get 4 of your people certified, and they'll evaluate your institution and say, we think your institution should have this many certified trainers, this many sessions to get people up to speed, this much time for staff to do this, that, and the other thing, follow up at 3 months. So they're pretty cool, and I've been dealing with them a lot on the phone. I really respect them a lot. They're neat folks. You can actually tell when somebody at HeartMath picks up the phone that they do HeartMath. They're really calm. They're really awesome.
Will insurance companies pay for it?
So far, I haven't had much success. If you're certified, you can get a $40 discount on the device for folks. I'm not that far into the insurance process. I think a bunch of my private insurers are going to pay for it as durable medical goods, and I write prescriptions for that stuff. So I'll put the ICD-9 code down. I'll write M-Wave 2, you know, number 1. Tell them to call their insurance. I think we'll see some private insurers pay for it. Medicare hasn't. There's this kind of X-Files quality to Medicare's response. Like if you call a certain individual at a certain time in a darkened room under the right circumstances, they might say yes. You know?
And the stars in the universe are all aligned perfectly.
For those of us who watched X-Files.
Right, I'm dating myself, yeah. Other questions or comments?
Actually, I have one. I was the state of Alaska's retiree medical person for a number of years, and I'm just wondering if you have contacted Becky Haltberg, the state of Alaska. She's all about wellness, and she's thinks out of the box, and she's come out of the Juneau with all these brilliant ideas about things people can do for their health, and I think this would be a wonderful tool for the state of Alaska to look at, because they're the biggest employer in the state, pretty
Yeah.
much.
Yeah, I haven't. I'll write her name down. I'm about 6 months into my job here. I didn't mention it, but I'm the medical director at SVT as well as one of the physicians there. And so part of my responsibility is who are we and where are we going institutionally. And but I came up here expecting to be here for a long, long time. This decision for me and my family was like, where do we want to be for decades or the rest of our lives?
Yeah.
And so I appreciate having the name, and I'll just write it down and keep it on my sort of list of folks to try to connect with, because there's a bunch of really neat individuals, multiple levels.
Yeah, she's the director of administration, so she's right up there, makes decisions all the time.
I think we're at the turning of the tide
Mhm.
in terms of there's just enough penetration of these ideas into enough places and corners, et cetera. And again, we've got such a crisis. We've got to start getting and keeping people well as a strategy. So I think that combination of motivation and just these good ideas are really popping up everywhere. It's a neat age to live in that respect. And I really had a ton of fun witnessing my patients. I mean, I've been blown away. I thought it would help them some. It's been a game changer for some of them, just shockingly effective. And to me, that suggests that this unopposed washing machine of stress with low-grade negative emotions without interruption is brutal on people's vitality. So I think that's what they're doing. They're interrupting that cycle. Thank you so much, everybody. Really privileged.